Inflammation is one of the most important topics in modern medicine and especially in longevity medicine. Many people think inflammation only happens when something hurts or becomes swollen, but in reality there is a silent inflammation inside the body that can last for years without a person noticing it. Over time, this chronic inflammation slowly damages organs and accelerates the aging process of the body. Inflammation itself is not always a disease. Inflammation is actually a defense mechanism of the body. When we have an infection, an injury, or a wound, the body produces inflammation to protect and repair tissues. That type of inflammation is normal and necessary. The problem begins when inflammation stays in the body for months or years. That is when it becomes chronic inflammation, and chronic inflammation is associated with many diseases such as diabetes, obesity, fatty liver, gastritis, colitis, heart disease, brain disease, and even cancer. Chronic inflammation is mainly caused by modern lifestyle habits. The most common causes of inflammation include excess sugar, refined carbohydrates, processed foods, fried foods, refined vegetable oils, alcohol, smoking, chronic stress, poor sleep, lack of exercise, overweight and obesity, intestinal problems, altered gut microbiota, dehydration, and insulin resistance. Many people live with inflammation every day and do not know it because inflammation does not always cause pain. That is why inflammation is often called the silent disease. Over time, chronic inflammation begins to affect many organs in the body. It can affect the brain, leading to memory problems, depression, or neurodegenerative diseases. It can affect the heart, leading to hypertension and heart attacks. It can affect the liver, causing fatty liver disease. It can affect the pancreas, leading to diabetes. It can affect the intestines, causing bloating, poor digestion, constipation, or diarrhea. It can affect the colon, causing colitis and chronic intestinal inflammation. It can affect the joints, causing pain and arthritis. It can also accelerate skin aging and overall body aging. To evaluate inflammation in the body, some basic laboratory tests are very helpful. The most important ones include C-reactive protein, fasting glucose, hemoglobin A1C, insulin levels, lipid profile, liver enzymes such as AST and ALT, uric acid, and vitamin D levels. These tests can be done at the beginning, repeated after 3 months, and then every 6 months to monitor improvement in inflammation and metabolic health. To reduce inflammation, nutrition is extremely important. An anti-inflammatory diet focuses on eating more natural foods and fewer processed foods. It is recommended to eat vegetables, fruits, avocado, olive oil, fish, eggs, oats, seeds, nuts, and natural yogurt. At the same time, it is important to reduce or avoid sugar, soda, white bread, refined flour, fried foods, processed meats, alcohol, fast food, and ultra-processed foods. This type of diet should be followed for at least 2 to 3 months to begin seeing improvements in the body, digestion, liver health, weight, and inflammation levels. Ideally, this should become a long-term lifestyle rather than a temporary diet. Hydration is also very important. Many people live in a constant state of dehydration, and dehydration increases inflammation in the body. It is generally recommended to drink about 2 to 2.5 liters of water per day. Green tea, ginger tea, chamomile tea, and water with lemon can also help reduce inflammation and improve digestion. These can be consumed 1 or 2 cups per day for several months without problems because they support the anti-inflammatory process. Regarding supplements, it is not necessary to take many supplements, but there are 3 that are especially helpful for reducing inflammation. The first is omega-3 fatty acids, which help reduce inflammation and protect the heart and brain. The second is turmeric or curcumin, which is a powerful natural anti-inflammatory compound. The third is magnesium, which helps the nervous system, sleep quality, muscle function, and also helps reduce inflammation. These supplements are usually taken for about 2 to 3 months initially. Omega-3 is typically taken after breakfast, turmeric after lunch, and magnesium at night before sleep. After 3 months, laboratory tests can be repeated to evaluate improvement. Exercise is another key factor in reducing inflammation. Exercise does not have to be extremely intense. Consistency is more important than intensity. Walking, cycling, swimming, and resistance training are all good options. Ideally, a person should exercise at least 30 minutes per day or about 1 hour 3 to 4 times per week. Exercise helps reduce inflammation, improve circulation, improve insulin sensitivity, support weight loss, and improve overall health. If a person has chronic diseases or is older, it is recommended to have a medical evaluation before starting an exercise program. In summary, chronic inflammation is one of the biggest problems in modern medicine because it is related to many chronic diseases and to the aging process itself. To reduce inflammation, we must improve nutrition, drink enough water, sleep well, exercise regularly, manage stress, use some targeted supplements, and monitor health with laboratory tests. Longevity medicine is not only about living longer, but about living longer with good health and good quality of life, and controlling inflammation is one of the most important steps to achieve that goal.